Tips to avoid sleep apnea. Sleep apnea is a potentially serious sleep disorder in which breathing repeatedly stops and starts. In this condition, since the breathing stops in intervals, the body cannot get enough oxygen and the person feels tired in the morning even after getting a good hour's sleep. If you snore loudly and feel tired even after a full night's sleep, you might have sleep apnea. The more common form is obstructive sleep apnea, which occurs when throat muscle relax. In this video, we will show you 10 tips to avoid sleep apnea. Let's start. Tip number 1. Have a healthy weight. Obesity can cause airway obstruction in the upper body and narrows the nasal passages. These obstructions can cause you to stop breathing suddenly or for lengths of time while sleeping. Having a healthy weight can reduce sleep apnea symptoms by clearing air passageways. However, regaining weight can return the condition, so it's good to maintain a healthy weight. Tip number 2. Daily exercise and yoga. Daily physical exercise can increase blood circulation and oxygen intake in the body. As I mentioned previously, sleep apnea causes a lack of oxygen in the body, so exercise is a great way to tackle the situation. Other than that, some breathing yoga poses also help in clearing the air passageway, good oxygen intake, and reduced oxygen obstruction during sleep. Tip number 3. Avoid dry air. Dry air can irritate the respiratory system. That's why people suffering from sleep apnea often wakes up with a dry mouth. To cope with the situation, try humidifiers. There are the devices that are used to add moisture to the air. Humidifiers can open your airways, decrease congestion, and encourage clearer breathing. If you are using a humidifier, clean it constantly to avoid any kind of molds and bacteria. Tip number 4. Positional therapy. Sleeping in a side position helps to reduce sleep apnea for the people who generates this condition because of sleeping on their back. There are devices out there that one can wear around their waist, which helps the person to sleep on their side. Tip number 5. Don't take sleeping pills, anti-anxiety medication, or sedatives before bed. Not taking sleeping pills or sedatives before bed helps to keep the throat from relaxing too much. Usually, sleeping pills and obstructive sleep apnea don't mix because sleeping pills tend to relax airway tissue, so they are even more likely to block the airway. But the results of a study reported in 2009 suggest that giving people a sleeping pill for the first 2 weeks of CPAP therapy might help them get used to it and improve compliance later on. Tip number 6. Change lifestyle. Some changes in your lifestyle can also help avoid sleep apnea, like limiting alcohol intake and quitting smoking. Limiting alcohol is advised because its intake relaxes the breathing control muscles in your throat. It can also lead to inflammation in your air passageway, snoring, and interrupted sleep cycle. Just like this, tobacco use can also contribute to inflammation and swelling in your airways. This can worsen your snoring and your sleep apnea. So, minor changes in your lifestyle can save you from severe health risks. Tip number 7. Use mandibular advancement devices and tongue stabilizing devices. These oral devices help reduce the obstruction in the back of your throat by repositioning your lower jaw and tongue forward. The American Academy of Dental Sleep Medicine supports oral appliances as an effective therapy for sleep apnea. These devices allow for fine-tuned jaw positioning, which will result in better sleep quality by keeping airways open during sleep. Tip number 8. Eat Mediterranean diet. The researchers from the University of Crete in Greece examined 40 obese patients suffering from OSAS. 20 patients were given a prudent diet to follow, while the other 20 followed a Mediterranean diet. Both groups were also encouraged to increase their physical activity, mainly involving walking for at least 30 minutes each day. In both groups, the patient also received continuous positive airway pressure therapy, which involves wearing a mask that generates an air stream, keeping the upper airway open during sleep. The researchers monitored the patients during a sleep study known as polysomnography. This involved monitoring electrical activity in the brain, eye, movements, and snoring, etc. The patients were examined at the start of the study and again 6 months later. The results showed that people following the Mediterranean diet had a reduced number of disturbances known as apnea during the rapid eye movement stage of sleep, which usually accounts for approximately 25% of total sleep during the night. The findings also reveal that people following the Mediterranean diet also showed greater adherence to the calorie-restricted diet, an increase in physical activity, and a greater decrease in abdominal fat. The results of this small sample did show an improvement during one stage of sleep for people with sleep apnea. However, it did not show an overall improvement in the severity of the condition. The author suggests that further studies in a larger sample are required to fully understand the benefits of this diet. Tip number 9. Prop your head up. Elevate the head of your body by 4 to 6 inches or elevate your body from the waist up. Some people have decreased apnea if they have the head of their bed slightly elevated. This can be accomplished by using a sleep wedge pillow, which is a ramp of foam that is highest at the end of the bed, or use a cervical pillow. In some cases, an adjustable bed can be used to raise the head enough to eliminate snoring and help apnea. Tip number 10. Open nasal passageway before bed. Open your nasal passages at night by using a nasal dilator, saline spray, breathing strips, or a nasal irrigation system, neti pot. This will ensure a fine sleep at night. You will wake up fresh in the morning without feeling tired. Wish you all a good night's sleep. If you liked this video, then don't forget to smash the like button, subscribe to the channel, and comment your thoughts on this.